Welcome back. This is video 2 of the TMJ series. Today we're looking at the role of the TMJ, and hopefully you've had a look at the anatomy. You're quite comfortable with that. Let's get into it. So I'm going to put it on you first. What do you think some of the basic roles of the TMJ are? What are the basic actions? When are you using your TMJ? I'm going to let you pause the video here to think it through. Okay. Hopefully you've come up with some basic actions. The jaw, how does it move? I probably should have made this a bit more clear. Here's my jaw here. I'm going to do it for you. We have elevation, depression, deviation, protraction, retraction, and some degree of combined movement. Now I mentioned depression, but the jaw has an interesting way of doing this. It's actually got two motions to it. You have that first open, and then a second open where it comes out. When we were looking at the disc, if we go back to that slide, yeah, this is a nice picture. That first opening here, and then this second one as it comes down and then out. Patients might also report sometimes different strategies, different ways that they might avoid pain, where they might go down and then in and then around something, and that can be quite indicative of articular or discal pathologies as well. But looking a bit more functionally, mastication, chewing, you need your jaw. Deglutition, swallowing. How is your jaw involved in that, closing the mouth? Speech, talking, as I talk to you now, my jaw is moving. And facial expressions. But what does that tell you about people with TMJ issues? What does that mean? How does a person chew? How does a person express differently? How do they speak differently? How are they feeling pain, discomfort? How are these basic roles being affected because of TMJ dysfunction? But there's more! If you got any of these, I'm very happy. And I'm sure there's a load more above these, but some of the things I reflected on were breathing. How is your TMJ involved in breathing? Mouth breathing, nose breathing. The thing about the epiglottis, how does that affect it? Circulation, pterygoid plexus I was talking about in the last video, that venous system there on your jaw that circulates the unoxygenated blood through the action of those muscles. But also, tongue position, resting on the roof of your mouth. How does that circulate nasal fluids, sinus fluids? What happens when it doesn't? When you are mouth breathing, your tongue isn't against the roof of your mouth, whether that's at night while you're sleeping or during the day. That leads to stagnation of the fluids. What happens with stagnation of the fluids? Infection. What else? Cavity pressures. Name 4 cavities. Pause the video. You better pause the video. Do it. Okay, I believe you. Mouth, for example. Thorax. Abdomen, pelvis, pelvic cavity. All those cavities. Head positioning. What happens to the jaw in those head positionings? Proprioception. Let me give you an example. I'm throwing a lot of stuff at you. People love this example. You're stressed. I'm stressed. Work is tough. I'm going to start breathing from my upper ribs. What attaches to the upper ribs? Those anterior cervical muscles. They get shortened. When they shorten, what happens? I'm looking down. What's that going to do? Well, I'm just going to trip. I can't see what's in front of me. How do I compensate for that? You maintain Frankfurt's horizon, looking forwards, like that. You tuck yourself upwards. Look at this posture. Anterior head positioning. Anterior head positioning. That's an example. What actually happened there? Proprioceptively, we have those Golgi tendon organs, which are really quite numerous in the muscles, myotendons of your jaw. There's lots of horizon lines that I've had a look at through here, through there, where they really try to maintain that to get your eyes level, your ears level, your nose level. Proprioceptively as well, your teeth. Teeth are sensory organs. As they touch, your mouth knows it needs to relax a bit. Teeth are supposed to touch, allegedly. Mine don't. I have TMJ problems. It's fine. But as they touch, your brain knows, okay, if they're touching, I can't press harder. That's going to damage my teeth. So there's an element of relaxation there. And that's part of the proprioceptive feedback loop of your TMJ. That affects where your head is positioned. That affects how your jaw opens and closes. Cavity pressures. When you're in that anterior head position, you never think about this. Swallow. Take a breath. Really feel interoceptively inside. What does your throat feel like when you're in this position, anteriorly shifted? Okay, relax. Tuck yourself really far back. How's that feel in your throat? Breathe. Swallow. Okay, and then just normal. Breathe, swallow. That feels a lot easier, doesn't it? To me, I don't know about you, when I'm in front like this, I'm getting a lot of pressure in the back of my head, but my throat feels very empty. There's not really much pressure going through there. Tucked in. Loads of pressure in there. Natural, somewhere nice in between. Somewhere that can maintain its form. Doesn't use the muscles as much. But it's still not so much pressure going through there. And if that's happening in your head, what's the pressure like in your ribs? Oh, ribs really restricted. I can't open at all. There's no space. I'm really extended. So it's just interesting to reflect on that a bit. Now, let's get very osteopathic. Tensegrity. What is tensegrity? Well, I have an image here. Let's bring the pink cursor back into view. And let's look at these elastic bands. The shape here is maintaining its form because of opposing forces. We have this red tube over here. There's a compressive force from this elastic band pushing into that one down there. And it's maintaining form. What would happen if I just flicked one of those bands, or if I moved one a bit to the side? The whole thing would deform, it would collapse, or it would just go back to its normal shape, the same one here. Now I'm going to invite you to think about the body. Are we models of tensegrity? Well, I've upped the budget and we've got arts and crafts models here. I want you to picture this as the pelvis. It's quite clearly the pelvis, I don't need to tell you that. Anterior, we have your abdominal muscles. Posterior, the back muscles, the erector spinae, the thoracolumbar fascia, all of that. At the front, hip flexors. At the back, hamstrings. Tight hamstrings. Everyone's got tight hamstrings. Blah, blah, blah. What does that do? Oh. Okay, what's happening there? I'm shortening the hamstrings. You can see the pelvis is tilting posteriorly there. Interesting. Hip flexors. It's never the hip flexor, but if it was. It's tilting anteriorly. Okay. Well, what if I've got tight hip flexors and tight muscles in my back? Whoa. Look at that. Mega anterior tilting of the pelvis there. So that's an example of tensegrity, but we're talking about the jaw. Have you ever thought about the fact that your neck is up? This blew my mind. My friend said this. But all the muscles are pulling it down. What? How does that make sense? Let's think about the jaw. Anterior. Posterior. Over there, I can't reach. Actually, let's do this. This way. Yeah. What are these muscles here on the top? On the sides? I'm facing this way. This is my jaw. Anterior, posterior. These are the masseter, the temporalis, the pterygoids. Down here, what do we have? The digastric, the geniohyoid, or the suprahyoid muscles. Fine. If I just relax those muscles, what happens? The jaw falls. So, what's really maintaining that jaw in that socket? Sure, we have the capsule, those forces that go through the capsule, the sucking into its shape. But these muscles really play quite a big role in letting it stay in position. But if I were to gently relax, I'm not sure if that was quite clear on camera. Let's see if I can exaggerate it a bit more. Look at that. The jaw opens. This is something we spoke about a bit in the anatomy video. Relaxing of those muscles opens the jaw. Tensing back up brings it to normal. Let's get a bit clinical. This one's really tight. This one's really quite loose. Look at that. There's a deviation to it as it opens. Let's do that on the other side. If I can maneuver my way around this amazing model. This one's really tight. This one relaxed. Deviation to the other side. So that's a bit of an intro to where it can go wrong, and a bit of an intro to tensegrity as a whole, as a concept. But what did I say in the first video? It always comes back to the teeth. Sensory organs. What is occlusion? Occlusion is how your teeth fit together, essentially. How your mouth closes together. These right here are blatant examples of stuff that isn't quite right. You're not going to see that. You might, but you're going to need to find emergent things. It's going to be much more subtle than this. And one of the first things patients with TMJ problems will say is it doesn't feel like it's right. Something's different. It doesn't close right. It's like that proprioceptive feedback, it's off. The teeth aren't fitting together. They're biting themselves in the same place. I had that when I had my TMJ problems. I still do. I would always bite myself just behind the lip here. And what did that do? It made scar tissue. I'd bite it more. And that turned into a whole thing that spiraled. Teeth are sensory organs. Canine guidance is interesting. I came across this in a YouTube short randomly, just to show you how amazing and annoying it is to find these sorts of information, these nuggets. Canine guidance is I'm going to call it an occlusion concept, whereby deviating your jaw, you should contact your canines. They basically stop it. The point of this is so that you're not grinding the molars against each other, because you're essentially hitting the canine and then it will open down. If you look at this angle here, hitting and then it will open downwards so these molars don't grind together. If we come back to my example, if I do it now, if I go to the left, I can't feel any of my upper teeth. I'm just getting the two molars on the right hitting each other. So I'm going left, these molars on the right are hitting each other. If I go to the right, I'm hitting a bunch of these, and it is opening down a bit. What might that mean? Maybe I am tilted a bit this way. A bit like we showed with those tight muscles and then the relaxed ones. I'm tilting down and out like this. So then none of these teeth are touching, none of the canines are guiding, and it's stressing the molars here. But when I open to the right, that's still quite normal, but I do have an element of upwards, which is consistent with what I feel. I feel something like that. The muscle's really tight over there, and then here it feels open, almost, I'm going to say subluxed. It's not subluxed, which is like a partial dislocation, but it feels like it's out. Bruxism. I used the same picture because I couldn't find a good one. Bruxism, however you say it. What is that? Have you heard of it before? Teeth grinding. It's teeth grinding. This can be at night. It can be during the day. How do you know when you're doing it? Usually people don't. It comes in many forms. It might just be tense like this, but they're not really aware. Sometimes they are. It might be the very classic just grinding of teeth when you're stressed. When it's at night is when it's harder to pick up. You don't know you're doing it. But what's interesting is that there are signs. Things like having dreams about teeth, having dreams about grinding, having dreams about vomiting teeth, having dreams about your teeth falling out, etc. Waking up with sensitivity in your teeth, or feeling a bit looser in the teeth as you're putting all that pressure in. And we're also bordering onto pathology here when we're talking about this, but is quite an interesting concept of how stress can affect your TMJ, and that whole sensory loop and proprioception feedback I was talking about really gets a bit muddled in these sorts of situations. So that's all we're doing for today. For those of you eager people who want to do some homework, I respect it. I respect it. I racked my brain a bit on what you could do. First one, what forces are going through the jaw? Let's keep it basic at first. Think above the jaw, below the jaw, in front of it, and behind it. Think about the muscles, think about the ligaments, think about the roles, the movements, the actions. What's going through the jaw? What's actually happening? What are the daily things we use for the jaw? We went through the roles, but we use it for everything. This is quite a nice thing to think about in terms of your patients. What are they going through? But also maybe more functionally, like we were saying before, how is that function being impaired when there's issues? Breathing, as an example. Brushing teeth, as an example. What are some other ones you can think of? What's actually happening? And if you're already, you want to do that extra mile, just come back to tensegrity. Is the thorax floating? Reflect on that. Muscles, ligaments, bones, breathing, forces, vessels, embryology. What's really going on there? Have a nice little reflect on that. And then for the next video, we're going to start looking at where it goes wrong. We're going to go more into those symptoms that we touched a bit on now. And on examination, what you can find, how to examine the jaw. For now, though, that is all. As always, leave your comments, questions, concerns in the comments. I'll have the link for the slides in this video as well as in the last video description. And yeah, I'll see you in the next one. Bye.